You would be hard-pressed these days to find somebody who is not affected by heart disease in some way. You can probably think of somebody right now who has had a heart attack or who is living with heart disease, and who knows, maybe it's you.
Yeah, and that's why events like the next ones we're learning about are so important. David Morris is the executive director of the American Heart Association in Delaware, and he joins us this afternoon. Thank you for being here. First of all, the problem. Heart disease, #1 killer of men and women. That's just scary.
This is true. So heart disease takes more lives worldwide than anything else. It's the #1 cause of death around the world, in the United States, and right here in the local community. So it's a real fight that we're fighting.
So we talk about it a lot, but do you think people are listening? Are they doing anything to try to?
You know, I would say yes and no.
Yeah.
So, more and more people are aware of the dangers of heart disease and stroke. We're also the American Stroke Association, and stroke is the #5 cause of death in the United States, but it's actually #4 here in the local region. So, more people are aware of it. However, and you guys probably see it, and the viewers see it, that we are really we're not a healthy region. We're not a healthy country. More and more people are overweight. They're not eating the right foods. They're not getting the right amount of exercise, and therefore then our blood pressure is high, our blood sugar is high, our cholesterol is high, and therefore we just have much higher rates of cardiovascular disease and stroke. So this is really something that we're trying to make people aware of and fight that fight.
Yeah.
And it's not just adults. People of any age can develop heart disease?
This is correct. So there are cases, many cases in fact, where children are diagnosed with heart disease even in utero. And our research really, and the funding that the community and businesses and people around the world support us with, really helps benefit our research, and we really help fight heart disease and stroke at all ages and sizes and races and ethnicities.
So I was going to say, probably everybody's heard of the American Heart Association, but give us an overview of what AHA does.
Sure. So we are actually we're a worldwide organization, but we are in every county in the United States. We are a research-based organization, and that's really the #1 way that we're going to fight heart disease and stroke. But we have our youth market programs. You probably have, previously was called the Jump Rope for Heart, but it's the American Heart Challenge and the Kids Heart Challenge now, where we're in the schools educating kids. We are transforming healthcare. We're transforming systems. We work with all the hospitals in the region on improving their care. We also partner with the emergency medical units and first responders to make sure that they're providing victims with the right care as well. And we also work hard on policy. So, recently the state of Delaware passed Tobacco 21 legislation, where we raised the purchasing age for tobacco and vape products to 21 years old. And that's going to really save many, many lives over the years. We also have worked on healthy kids meal legislation, where we're making the default beverage option milk, water, 100% fruit juice. And that's just a little piece of what that investment does, but we're also just in the community educating people on eating right, getting physically active, knowing their numbers, and knowing the risks of heart disease and stroke and how to prevent those.
And you really do rely on the community, and that's where the Heart Walks come in. What can we expect?
Correct. So the Heart Walk is our biggest event that we do, nationwide, worldwide. In fact, we just recently had our Heart Walk in Wilmington, where we had over 3,000 attendees come out. And our Heart Walks, we do one in every county in the state of Delaware. So we have one in Rehoboth next Sunday, supposed to be a beautiful day, knock on wood, where we will have music, blood, health screenings, CPR. Come out and learn CPR. Learn how to be a lifesaver in the community. Such a high percentage of cardiac arrest happens outside of the home, outside of a hospital. So we want people to be ready to respond. We have kids activities, a band, and we just want to get people moving.
Yeah.
We really do. It really makes a difference when people are getting that, that exercise every day.
So while we're talking about Rehoboth, give us the place and the time.
Sure. So it's at the Rehoboth Beach Bandstand. It's on Sunday, September 22nd. The event itself, registration opens at 9. We have a little opening ceremony just before 10, and then the walk itself starts at 10. We hope people will come out, honor and, and be in memory of those loved ones who have been affected by heart disease and stroke, learn a little bit more about what we're doing, and hopefully support this great fight that
And
we're
you're
in.
also at Delaware Tech.
We are. So October 5th, if you can't make it to Rehoboth on the 22nd, Saturday, October 5th, 8 a.m. registration opens at the Terry campus in Dover. And again, these events are completely free for the community. So of course, we'd like people to make a gift to us. They can do that at heart.org/Delaware for more details. But also, really just we want people to come out, have a good time, get involved, get moving, and learn about heart disease and stroke and how to help us.
And WBOC is involved as a sponsor.
Yes, we appreciate you guys. Thank you so much for your help with this.
David Morris with the American Heart Association. Thank you so much.
Thank you.
Good luck with the walks.